You know, Washington politicians, all of them, got this wrong. And I do support the framework of Obamacare, but it does not do enough to control costs. It does not do enough to reduce costs. And I think the best way to rein in the costs is to figure out a way that works and, you know, find out what doesn't work in healthcare. Patients should be able to receive appropriate care and course of treatment without unnecessary tests or procedures that add billions to the cost of care and does nothing to improve patient outcomes. You know, in the healthcare industry, this practice is known as upcoding, and it has to stop. The medical community must invest in comparative effective research, studies that will help us determine the best treatment protocols for medical providers. So, you know, I support an expansion of the health information technology. I'm an IT consultant. I understand that if we improve the technology that's going on in our hospitals, that we can control the cost of healthcare.
Thank you. Congressman Pitts, you're on record to repeal and replace Obamacare. Please tell us what would be in the Joe Pitts replacement of Obamacare. 2 minutes, sir.
2 minutes. First of all, Obamacare is a job killer. It's going to result in hundreds of thousands of jobs being lost. It's going to result in millions of people losing their health insurance. It needs to be repealed and replaced, and I mean take all the language off the books. We will replace the low-hanging fruit like pre-existing conditions, kids staying on their parents' insurance till age 26. But there are many market-based reforms we can pass. We can pass, for instance, competition, providing competition across state lines. Right now, you can't buy health insurance outside of Pennsylvania. Now, you can buy car insurance from a lizard. You can't buy health insurance from Delaware, Ohio, or other states. There are hundreds of insurance companies, hundreds of plans. If you gave people an opportunity to choose and select, competition would bring down rates. We need to be able to pool across state lines. Now you cannot. There are vast pools, people, groups, Rotary clubs, trade associations, whatever. If you had the power of bulk purchasing and negotiation, rates would come down. Portability, so you could own your own health insurance, take it with you from one job to another, one state to another. Tax treatment for an individual, same as what a company gets when they provide health insurance for an individual. Same kind of deductions, incentives, expand HSAs, medical malpractice reform, the cost of defensive medicine. Tests being done by hospitals and doctors many times just because they're afraid of being sued results in the cost of health care in this country increasing more than $125 billion per year. SGR, fixing the doc fix, Medicaid, block granting to states. There are many things we can do in replacing this system that intrudes on over 17% of the economy.
Thank you. Mrs. Strader, you have 30 seconds to ask a question of Congressman Pitts.
The medical loss ratio is a penalty applied to those insurance companies who do not spend a set requirement of premiums on actual care for their customers. Congressman Pitts, do you believe that insurance companies can deny paying out for coverage in order to increase their profits, essentially doing away with the medical loss ratio?
No, I don't support doing away with the medical loss ratio. And it depends on the size of the company, whether they can absorb all the administrative cost in that 15% or whatever it is with the MLR. But there are efficiencies that can be provided and encouraged in the system. And I might mention Obamacare has 20 new taxes that are imposed beginning next year that we also need to repeal. This will be a job killer, especially for the medical device industry, with people that I've met with, especially smaller companies. It's a 2.3% excise tax on not profits, but total revenue. And I've had many of the CEOs that I've met with in companies in the district and elsewhere say they're not growing their businesses here anymore, they're growing overseas. With those jobs go innovation. We need to recapture those jobs, keep the United States the best place for pharmaceuticals and medical device companies. Thank you.
Congressman Pitts, you have 30 seconds to ask a question of Mrs. Strader on this topic.
Yes. My Democrat opponent 2 years ago was a proponent of the single-payer, government-run health insurance monopoly. When Obamacare passed the House, She publicly criticized it as a giveaway for insurance companies. Do you agree with that position? Should we just get rid of private insurance altogether and put the government in charge of everyone's insurance?
Well, first I want to say that it's no wonder you have this position on healthcare with the hundreds of thousands of dollars that you've received from the healthcare industry. And I believe, I grew up a child of poverty. I did not have access to healthcare as a child. The first time I saw a doctor, well, one of the first times I saw a doctor was when I joined the United States Army as an E1. So I believe that something like the Affordable Care Act has allowed people like my mom, who worked as a waitress and didn't have access to buy health insurance, an opportunity to now cover her 10 children. And I think that it's in the right direction. We've got to continue to do this. And I believe that this is a really good start to taking care of all the citizens of the United States.